Hey everybody, I'm Dr. Skowron from Autism Awakening. Today is our podcast to help you help your child with autism. I'm excited about today's podcast because we have another guest speaker. And our guest speaker is Nicole Rincon, and she is going to be joining us right now. We're bringing her on in. And I think she is connecting super quickly. Hello, Nicole.
Hi, good
How you
morning.
doing?
I'm doing okay. I'm a little sick today, so if I'm clearing my throat, I apologize.
Oh no, I'm sorry. That's
Yeah,
what the kids bring home from school.
you got three of them, so
Yeah, you're like the eye of the storm.
I am.
Anyway, I was just kind of introducing our podcast and talking about you being our guest. So let me just kind of finish a quick introduction, and then would love to kind of hear, why you're here in our community and what brought you here. But Nicole and I have known each other since, what was it, 2017, 2018?
Yeah,
Um,
sounds about right.
Yeah, it's those years before COVID tend to blend
Right.
together. But we met at the TACA conference, which obviously we're huge fans of. And, Nicole is another biomedical expert in the world of autism. And she works with Dr. Rosignol, who again is one of the hugest, autism biomedical docs in the world. And so she's amazing at helping kids recover their skills that they've lost. And so I wanted to bring her on to kind of talk about what she does and how she does it, because it's so good to hear from different people. Obviously I've got a telemedicine practice and we help people, but we all do things in different ways. So wanted to kind of bring you on, but I guess first tell everybody who's listening why are you even in this world that we're all in?
You're right. Well, thank you again, Jared, for having me on. I really appreciate it. It's been a big compliment. Thank you for the compliment as well.
Oh, yeah.
Yeah, so just as my medical background, I'm a physician assistant. I've been practicing for 17 years, and I currently work at Dr. Rosignol, or with Dr. Rosignol at Rosignol Medical Center, and I've been there since 2016. Like you said, I think I met you the following year. And yeah, my story, I wanted to share my story for a few minutes here about autism, because it's kind of a unique one, and it's certainly directed my life, and personally and professionally. So I met my husband in 2006, and we got married, and we had some traveling, we had some fun. Became a PA, started doing wellness there. I was actually working at a wellness center doing nutritional counseling. And we were trying to get pregnant, and basically it was several years and nothing. So yeah, and so I tried to, testing thyroid and things, but I didn't know what I know now. So essentially we did fertility treatments, and I took some medication for ovulating, and I ended up, actually I got pregnant. I had a miscarriage, unfortunately. And then the third and last time we were going to try, I got pregnant with triplets. So they said, "Oh, congratulations. Yeah, you have 3 babies, not just one." So, we went through the pregnancy. I was on bed rest. It was a very difficult pregnancy, but we gave birth at 34 weeks. Very healthy kids overall. I was very grateful. We brought them home after 2 weeks in the NICU. And they were doing really well, following all their milestones up to a year, 18 months. I was like, yeah, good job, Mom. Good job, Dad. And then around 18 months, I started to notice that my one son, strangely, he had a strange presentation. He started shaking in the morning, and he had these like tremors. And I thought, that's very odd. And he seemed kind of spacey in the morning. And so we went to the regional center here in Southern California. We were in San Diego at the time. And they said, yeah, and I noticed his speech kind of started to get funky. He had normal speech, and he kind of started having articulation issues. He'd be like, this, and I'm like, that's odd. So anyway, we got this whole workup, and they said, well, it looks like he might have autism, some regression. And we were, it was kind of, okay, well, it's not too severe. And then forward 6 months later, as we're doing this workup, in the summer, when they just turned 2, my daughter started having seizures in the morning. We woke up, and she would just completely space out. And she would lip smack. And my son, completely within like 2 weeks, lost all of his speech. And he started spinning in a circle, smearing his feces all over the wall. This was a child that was speaking 2-word sentences. He had over 50 words and no speech. And I can't express to you how, like, all 3 of my kids, they diagnosed both my boys with autism, my daughter with seizures at 2. And I was just devastated. My husband and I, we had lost our children. We felt it was just, I was devastated. I went into depression for a little while, and I had to take time off work. And anyway, you know, I thought that I was going to be, I thought my life trajectory had changed forever. And turns out it had, but not in the way I thought. And after about 6 months of just kind of floundering and being in bed, I said, you know, I got to do something. This is not me. I can do this. I'm a PA. What are we going to do? Okay. So let's just pick yourself up, Nicole, get out of bed. And I started to go online like all the other moms. So I just went through PubMed, autism treatments. What do I do? What are the studies? What are people doing? I looked up apraxia for my son because he wasn't speaking even a sound. And so I looked up fish oil. You know, I found this omega-3 study with the vitamin E. I thought, okay, let's do it. I started giving him omega-3, and he stopped spinning. He stopped hitting his head against the wall. His stools normalized. And he was starting to make some eye contact again. And I thought, oh my gosh, I'm onto something. And so more research, staying up till 2 a.m., you know, not sleeping, you know, N-acetylcysteine. I found some probiotics. I found, you know, some multivitamins. So we started adding things in, and I noticed that things were getting better slowly, but there were improvements. I thought, okay, this is something I got to do now. I ended up, after a little while, I ended up going to a MAPS conference, which is the Medical Academy of Pediatric Special Needs. I walked into the conference, and I just said, look, I'm here to learn. I'm going to do all the modules, but who's the man? Like, who's the doctor? Who can I work for? I want a job. I'm going to do this now for a living because I got to figure this out. The best way to do it is to jump in. I'm going to be an autism provider. And they said, oh, Dr. Rosignol, he's the guy that founded MAPS. Like, great. And I just walk up to him. I didn't know, no idea who he was. I hadn't even heard of him. I'm like, are you Dr. Rosignol? And he kind of like, yeah. I'm like, oh, so I'm a PA. I'm Nicole. Can you hire me? And he's like, what? Do you even know who I am? I'm like, no, but everybody says you're the man. So I'm here, you know, you're the expert, you know? So he's like, oh yeah, sure. You know, you have a resume, you know, he's like, do you have a license? So it was hilarious because he kind of hired me on the spot. And he just kind of, and I sent him the resume. I think I was working for him like the next week I started training. So I just jumped in and I was, you know, trained with him. I did the MAPS modules over several years. I did everything that I, you know, with my kids that I was doing in practice. I was doing it at home, all the testing, all the stool, all the, you know, blood and the EEGs. And, you know, now we're here at a point, it's been fast forward 10 years. My triplets are now 12.
Wow.
And I know it's been 10 years. It's just been a long 10 years. And I'm so grateful. I'm so blessed. Like my son, who severely regressed, now has lost his diagnosis, and he is complete. Like, he's getting straight A's in general ed, has friends. You know, we have a little bit of speech. We still have a little articulation, like residual. There's some little things here and there, but I mean, oh my gosh, I'd never thought we would be here. And my other son is, you know, doing well. They're all in gen ed. My daughter's been seizure free for like 8 years. And so we really, I thought, you know, I need to do this. Like, I think I was blessed and I was given this gift to help other people too. So it really helps drive you when, like, you have a personal story.
Oh, yeah.
I mean, you know, talk about purpose. So I just said, well, I guess this is my purpose in life. So now I'm doing this and it's wonderful. I mean, it's very challenging. So like I said, I've been treating kids with autism in a biomedical functional medicine capacity since 2016. And we have a great medical staff, so lots of support. I mean, Dr. Rosignol is brilliant, and we also have nurse practitioners that work there, and Dr. Fry is at a satellite office in Arizona. I mean, these are just really bright men that have been doing this, and so it's nice to have a good support team too.
Yeah.
So that's my story. I mean, it's kind of intense, but and it's been a long one, man. I'll say it's tiring. It is not. My eye bags are worse for wear. You know, we're just, but you know, it's beautiful. It's like I would do it again. I mean, over again. I mean, I thought it would be the end of my life as I knew it, and I guess, it was, but like I said, in a very positive way. So, I mean, it started a new beginning.
Yeah.
So,
Well, that's an awesome story. I didn't know you had
oh, you
triplets. I know you had
didn't know
three kids.
that?
I didn't know they
You
were
did.
triplets.
Oh, yeah.
Um,
Yeah, yeah.
yeah, and, my daughter's 12 as well, and we very similar timing track for our age.
Yeah.
But a few things that you said, I think so many of our families resonate with,
Yeah.
which is number one, I was depressed and I thought this was the end of my life.
Yeah.
When you first get
Oh,
that
man.
news, I can't even imagine.
It was the worst news of my life. I mean, you literally feel like you're in a dream. It feels surreal. You feel like you're in a nightmare. Like, this can't be happening. What's wrong with my child? Why did I lose my son? It's
Yeah,
like, it's yeah,
yeah.
yeah. It's
So
it's it's devastating, and yeah. It's so yeah.
yeah, I can't even imagine. I know, every parent goes through that,
Oh
just
man.
what you go through, and you've been in it. You've been in that
Oh,
track. So, and the other thing that you said, which I want to highlight on, is, hey, guess what? I poured everything in my life into
yeah,
this, like so many of our parents do.
yeah,
Um, and now your kids are mainstreamed, losing diagnoses, and that's what every parent wants.
yeah,
It's how amazing is it for you to give this message, not just as a mom of
yeah,
three kids on the spectrum, but also as a health practitioner in
yeah,
it.
yeah,
So
yeah.
I would love to kind of, and I'm sure everybody listening, I want to segue over to what did you do for your kids along those years that seemed to help them,
Yeah.
on that road to recovery, and how do you now fuse that into your practice?
Yeah, so that's a good question. And like I said, it began, well, I really had to I had to unlearn a lot of what I thought I knew. So a lot of it was reanalyzing everything. What Down to the bare basics. And we kind of know this now is kind of standard functional medicine practice, but what are they eating? Number one. What are my kids eating? Is it, I didn't know back then, organic, and we were eating just regular food, regular tortillas with pesticides and herbicides and all those kind of things. And I think it was having a big impact on their gut. So when I really cleaned up their diet, I took out gluten, I took out the dairy at the time. So we did gluten-free, dairy-free, like I said, organic, took out all of the inflammatory oils. So I was really big into that. We used to only cook with canola oil. I thought it was healthy. I mean, I poured it into everything, and I'm like, okay. So now, we do mostly, olive oil and coconut oil. And, we now have recently introduced some butter and ghee and things like that. But back then we did ghee, which is the clarified butter without the protein in it, the casein. And so that was a big deal. So the diet was number one. Cleaning that up really helped a lot of the issues we had with sleep. A lot of the brain fog issues too. Like they had more mental clarity with the diet. Cleaning up their water. We were fortunate. We had a RO, like a reverse osmosis filter. So making sure that the water that they were drinking was really good. Cause it does matter, the air. So, kind of to back up, I mean, it's a long story, but my personal story was part of our issue. I think we had a water leak in our downstairs bathroom,
Mhm.
and it was really bad at the time when my kids regressed, and I knew it was there, and we ended up busting open the wall because I was a young kid, and we didn't remediate it properly. We just opened up the wall, and the water had been leaking there for like 6 months. So, we probably got this huge dose of mold exposure, black mold, because, and I just didn't know. We were trying to save money and not call ServPro. So I think that was a big issue. So basically, cleaning up the house, making sure that our house was environmentally, clean from molds, or as clean as you can get. Putting in air filters, air purifiers in every room seemed to help. And making sure, I was really big into sunlight at the time too, and I still am. Making sure that my kids went outside. We were playing outside. I went to the park every day, took them for walks. I wanted to get them sunlight. And yeah, and then the supplements, like I had mentioned, we'd started that. We hadn't started any, medications at the time, although, like I'd mentioned, I think some of the first were maybe some omegas and acetylcysteine. We did probiotics. I did some digestive enzymes initially. The only medication we did start at 4 was leucovorin, which is a high dose folinic acid. And I think that really helped my daughter with her seizures.
Right.
And I think that really helped my son's like regain his speech. So I'm a huge fan of high dose folinic, the the
Oh,
leucovorin.
yeah.
We have the folate receptor antibodies, and even I do too, so I take it as well. And so I think like those are kind of the initial steps that we took that I was really noticing big
Right.
changes.
Awesome.
Yeah.
Awesome. So let me ask you, something. You mentioned that you had to unlearn things.
Yes.
So and you diet and the house and the environment and cleanliness, etc. What, because you come from a conventional medical training,
Yes.
was there anything you needed to unlearn from that to kind of get into this
Yeah.
world?
Yeah. I mean, not to put too fine a point on things, but one example, was that with Tylenol. So like we were always taught as practitioners, I mean, I did a peds rotation. I'm trained to do pediatrics, and everything's Tylenol. Oh, your child has a fever, take Tylenol. They're not feeling well. And so I used to dose Tylenol all the time, thinking that was the thing to
Right.
do. And looking back on it, I think that was at the time they were getting frequent colds, I think because of the mold in the house and because of other things, but they were always kind of sick. And so I was giving them Tylenol all the time. And, I don't think that helps. So just that idea of what mainstream medicine is telling you is okay, especially with medications and may not be okay, especially for our kids, like my kids with,
Yeah.
developmental, disabilities and just sensitivities. I mean, as a child, I was a sensitive child, and I know I have sensitive kids, and it's like, well, just because some other kid can tolerate it doesn't mean that's okay for my family or my kids. And
Right.
so, having to learn that not everything is okay for everybody. Like the general guidelines don't always apply.
Yeah. Well, hey, if you're allergic to penicillin, you're not getting penicillin.
Right.
So,
Right. And it's that same idea, so yeah, so that was definitely, a lot of things that we were trying to do. I mean, like I said, this was kind of general guidelines, and they just weren't necessarily going to work for my family. So
exactly. Exactly. We're all different, we're all unique.
Yep.
So,
Yep.
awesome.
Yeah.
So talk more to our listeners now about, now that you've been through
Yeah.
this and it's been a decade plus,
Yeah.
and you got some real experience,
Yeah.
underneath your belt. When you're working with patients in the office, what do you do for them that helps?
Well, gosh, I mean, that's it's a big question. So, I mean, obviously, we start, with the basics, like we talked about, the food and the diet and the, water, air that they're breathing, everything that you're taking into your body matters. And also, I mean, a good functional place to start is looking at bowel movements. So, I mean, so many of our kids, and this, are constipated or have diarrhea, and really addressing those issues first, because you're not going to be able to detox a kid or recover a child that's pooping once every 4 days. And, if you try to give them medications or supplements or things, they're all going to react to everything. So, I always make sure that we kind of start with the basics of, are they drinking, and pooping, and sweating. What are the 4 ways we detox? Sweat, breath, urine, and bowel
Poop.
movements.
Yeah.
So it's like if you're optimizing, we got to start there. And then once they feel like that's on a better track, but to get on there, we usually do a stool test for our new patients. And periodically, I mean, we do them for adults, so young kids. I mean, with some kids, we have to do them every few months. I try not to do it that frequently, but some kids have a lot of GI more than other kids. Like, where it's just, oh my gosh, you have Klebsiella, or now you have Proteus, now you have C. diff, you have this, that. So we usually do a stool test, address that. I like to get an organic acid test, which is the urine metabolites, checking for different fungal and bacterial metabolites. That can be super helpful, especially looking for Clostridia. That's a big problem with a lot of kids, that when you treat that, a lot of the behaviors get better. I mean, it can be quite miraculous. I mean, really, like, kids that are, and I had this experience too when my son, when he was younger, he was just kind of a menace, and he would break things, and I remember he went up to grandma and he broke her glasses, and she's like, what? And then I treated him. We gave him some, antibiotics for his, and then he was just the sweet little kid again. So, I mean, it matters. And we can talk about, the things that, I mean, we do blood work, a super intensive blood work, but looking at metabolites, or, metabolic markers, like zinc is huge, vitamin D is huge. Iron studies are huge for attention. We look at immune function. So we'll look at the IgA, IgM, IgGs, as far as like a total immune panel. We look at, I mean, gosh, it's pretty obviously like anemias, liver functions, and we look for mitochondrial markers as well. So we do a big mito workup. I know Dr. Fry, Dr. Rosignol are big into that, because some of these kids it's pretty significant, and treating that can help with speech and some of the core autism symptoms.
Yeah.
Yeah. And then, typically the other thing that we look for, I mentioned the cerebral folate deficiency. I test every kid for that with the folate antibodies, folate receptor antibodies. That's huge. And that makes I would say that's probably one of the biggest things that we do that, that really moves the needle, especially in younger kids.
Yeah.
And then the other thing is I know Dr. Rosignol, he's really big into looking for seizures. So we try to do overnight EEGs because it's very common. Especially for girls with autism. The females tend to have a higher seizure rates, ironically, or at least epileptiform discharges.
Yeah. Interesting.
Yeah. So it's more prevalent in females, and it's also more prevalent, with regression. There's been some associated with EEGs and regression. So we definitely look at those and try and treat them, And as I mentioned, sometimes the folate treats it in and of itself, and sometimes it doesn't. Sometimes it's treating the gut can help too,
right,
for the seizures. So yeah, that's kind of the basics. I have a full video on my website that talks. It's an hour for all the testing and treatments. This was a 5-minute condensed, but if you want the whole speech, there's a big long list of everything that we kind of look for as a workup, and it's extensive. But yeah, it all helps.
Oh yeah, no, for sure. I'm glad you brought up the gut infections, the behaviors. I had an appointment today with a mom, and she's showing the kid is screaming and rocking and and stimming, and he's obviously uncomfortable. And they got a call from the principal saying, look, his behaviors are too bad, and we can't have him in school anymore.
Yeah.
And they're at this point of like, what do I do?
Yeah.
Like all day long as my kid is like this, and now he's getting kicked out of school. And am I the bad parent?
Yeah.
Am I the one that raised you like this?
Yeah.
I said, no, this is not parenting.
No.
And we had our lab results, and we had the stool test from LabCorp that had 2 parasites.
Yeah.
2 parasites on a LabCorp stool test. And that causes pain, that causes behaviors.
Oh yeah. And the inflammation, the neuroinflammation and the pain and the mitochondrial dysfunction from the gut bugs, it's just this perfect storm. And then if you treat it sometimes, especially when you find the right treatment, the right antibiotic, for parasites, like there's a few medications like Alinea can be really helpful. I have some kids where oh my gosh, it's night and day, literally overnight, like, holy cow, that's amazing. So you don't always get so lucky. Sometimes a lot of these kids, we get some of the really hard kids that, that are very difficult to treat, but sometimes you kind of hit a home run and you really find something that makes a big difference.
Yeah. Well, it's awesome that those home runs happen.
Yeah.
And that's what our parents need to hear is that, hey, guess what?
Yeah.
You can do this. You can help your child get better.
Yes.
So we're getting a lot of awesome live questions.
Okay.
I want to get to those in a second.
Okay.
But before we do, because I think it's going to be great to hear your point of view on these answers.
Yeah.
What are some great stories from your office that you can share? To inspire families like, guess what? This is doable. We can do this. We can help.
There's been, single stories. There's been, so there's a story. There's a patient that I really like to talk about that even I think that she was 21 with autism and almost no speech, nonverbal. And I know Dr. Rosignol started her on methyl B12 injections. And she started speaking, and she was 21 years old. And so, we had it was just amazing where people think, oh my gosh, they're too old. They're past the age of recovery. There's nothing you can do. We've given up. This is it. It is what it is. And I understand that. I understand, it is a balancing act because as parents, you really have to protect yourself too. You can't get burned out. If you're feeling like you need to rest, you need to rest. And I took a little time off myself too, a few years back of just let's just not test. I need a little break. The kids are okay. We'll just maintain. And then you kind of jump back on when you're ready. Yeah. But, so it's that fine line of giving yourself the rest you need, but also having hope and saying, I'm feeling inspired. I heard this doctor, or I heard this treatment, or let's try it. What do we have to lose? Let's give it a go. And there's always hope. So that is amazing, I think, at any age. And it's a big lesson that there's always hope.
Yeah. I love that you say that, because that's my answer whenever somebody asks me, like, what's the most important thing? And
Yeah.
it's, there's always hope.
Yeah.
We've seen too many people. I mean,
Yeah.
thousands of
Yeah.
people, and helped, some a little bit and some
Yeah.
a lot. And there's always hope.
There's always hope.
Yeah. So,
And sometimes it's small. I mean, everybody's story is different. But you start small. You start with a few things and you kind of expand on that. You just kind of expand the borders, the edges of what you're looking at, what you do, and after a decade, you're eventually like, hey, that's pretty good. But yeah, it's and it takes time, and so it's not. I always want to caution parents. Sometimes there's not this overnight aha. Sometimes it is just like my story. I mean, it does take time, and the improvement can be great too.
Yeah.
But it's there, and there's hope.
Oh no, for sure.
So.
For sure. And I tell all my patients, I want you to take a video. I want you to do like a 30 to 60 second video.
Mm-hmm.
Now it's the holiday time.
Yes.
We're going to remember the holidays. I don't remember what happened last August 5th, but I remember the holidays. So those videos, especially now, holiday time, you can see it. It's right there in front of you. Look at the difference. So we're in it day to day, and it muddles together.
Yes. Oh yes.
All right, let's get to our, like I said, we got a lot of good questions, and I know your answer for these are people want to hear. Before we do, what's a place people can contact you, website, wherever?
Oh yeah, thank you. Yeah, I was going to mention that at the beginning. So I have my own personal website. It's just www.NicoleRincon.com. So my first and last name. It has some videos. I always refer people there because it has some of my Taka videos on there. So it's got a couple different podcasts, a couple Taka videos, so you can see my presentations in the past, live, which has, some pretty good information, I think, about just kind of how to start out with autism. Right. And then one of my speeches is on pregnancy and prevention of autism, which I also think is super important. Yes. So that's on my website. And also, if you want to see me, I practice medicine at Rossignol Medical Center. And that's I think it's rosignolmedicalcenter.com for the website. So then I'm actively seeing new patients. So yeah, that's about my contact, and you can send me messages through either one.
Sounds good. Yeah. So, and in your office just south of LA, correct?
We are in Aliso Viejo, which is kind of South Orange County.
Got it. All right, perfect. Just so people know. And your website is your name, Nicole Rincon, and so NicoleRincon.
Yes.
.com.
Thank you. Right. Thank you.
That's okay.
Yeah.
Important for people to know how to reach you. All right. So let me get to some of the live questions, and shoot, I misplaced my cheaters. So you may. I thought like 3 in the house would be enough. All right, live shout out to Diane. Live shout out to Sandra from Florida. Carolyn from Sweden. This is the first time she's watching live. Hi, Carolyn. Diane's from Canada. Diane, here's a question.
Okay.
Diane asks, how do you deal with dyspraxia?
Me or you? Is it directed at me?
Let's go with you. They hear me every week.
Okay. I don't want to take the spotlight. So, speech, in our practice, we equate a lot of speech difficulties to the mitochondrial dysfunction component of it. So optimizing those mitomarkers. So, for patients, it depends on how in depth you want to go with testing. We usually look at several things on the blood. There's also something called a mito swab, where we'll see how your mitochondria is functioning. But we may typically start with some supplements that known to help mitochondria, like CoQ10. Again, we talk about the leucovorin can be helpful. And carnitine is another big one. We see a lot of carnitine deficiency that will help with speech. And, there's, like I said, there's a whole, I like to really get a test I find helpful is plasma amino acids in the blood work, because it really does show you a snapshot of what's going on in their body. And I like it because some kids are, oh my gosh, I saw a kid that was deficient in taurine, and we added in taurine, and it made a difference, and vice versa. And you can also see, like I mentioned, the mito markers on there. There's certain things like the alanine to lysine ratio. If that's very skewed, then that can be an issue that we need to address. So in a nutshell, basically looking at, and when I say mitochondrial dysfunction, I'm sure you've talked about it on your podcast before, but it's basically that energy production. And these kids are shown to have low energy production, especially for high demand neurons in the brain. They need a lot of energy. So when you don't have it, things don't work properly. And so that's typically where we're going. But again, it's a whole comprehensive workup and that we start with, and usually move, start from the basics and then move forward. You don't usually start at mito. We start at the gut and everything else and move forward.
Yeah. Like you said, if you're not pooping, nothing's going to work.
Yeah, exactly.
Nothing's
You're just going to be kind of toxic and, typically. And
yeah.
Yeah.
You got to go with that. All right. Next is we've got, as I'm scrolling through, Armando from Florida. Hope Enzo's well. Audrey's from London. Live shout out to her. Diane's asking me a question about a couple of our products, our folinic acid supplement versus our Power and Focus. I would say start with our Power and Focus supplement. It's more comprehensive. It includes folinic acid, it includes B12, it includes zinc and magnesium, but it's also got amino acids that are going to help the brain, like Nicole mentioned GABA. So we've got GABA in it, 5-HTP, that kind of stuff. So start there. Diane also asked a question about our product. Is the ATP in our folinic acid that improves motor skills. So we put ATP. ATP is the molecular form of energy that the mitochondria make, since we're talking about mitochondria. So we've got ATP in a couple of our supplements. It seems to work better not on the motor skills, but on the gut function, because the ATP can improve the mitochondria in the gut, improve really chronic constipation, improve immune system function within the gut. Supporting mitochondria will help with motor skills, but I don't see the ATP specifically doing it. Audrey, Nicole, I want you to answer this. What's the best supplement to treat epilepsy in autistic children and adults that is toxic free?
Well, so again, the seizure component of autism is well known. So they say statistically, some studies show that about a third of kids with autism have seizures. The other third have increased, they have epileptiform discharges. So when they're sleeping, they get those spikes. A lot of it, is theorized to be caused from excess glutamate. So glutamate in the brain makes the neurons fire. And, GABA is the opposing neurotransmitter that calms things down. So, supplements that, increase GABA are going to be helpful. So, you can take GABA in and of itself. I like N-acetylcysteine a lot. I like taurine a lot. Theanine can also increase GABA. Even magnesium you mentioned can also be calming. Now these, again, a lot of these things, like I said, seizures backing up sometimes are from folate deficiency in the brain, and they can also be from infections in the gut. So I've had a lot of kids that have a lot of propionic acid from maybe Clostridia overgrowth, and then you treat the Clostridia and the seizures get better. Not always, and there's genetics behind it. There are, like I said, familial components, but in general, we will try to clean up the gut. We will try to optimize folate in the brain, try to optimize the mito. And if none of that works in our practice, we do use seizure medications because we're a medical practice. So, we may use, Lamictal, like lamotrigine, or we have some other kids on other things like, Keppra, or some kids even use GABA medications, that have to resort to something like Ativan, or, we don't do that though. We super, super rarely get there. But we do have patients that, we do the full spectrum of whatever we need to do to stop the seizures. So.
Yeah. I remember a patient of mine who had a genetic condition that caused his seizures. I forget what it was, but he was having 30 a day.
Yeah.
So he was taking the max dose of Keppra for his weight. And still having 30 seizures a day. So he had to have, he wore a helmet because he would fall down 3 times an hour. Yeah. And we started him on folinic acid, just 1 milligram, and he went 30 to 0 a day.
Yeah.
So, combining all these things is amazing.
Again, it's a big deal. Like I said, it helped my daughter significantly with her seizures. So. Well,
for sure. I'm going to answer Tina's question. Tina says, if your child's on an ADHD stimulant, what's the supplement to try that works similar? You want a supplement that increases dopamine production in the brain. So we have something called Attention on the Double. That's going to support, it contains tyrosine, which is going to support dopamine production. Colleen said, good afternoon for you. let's see. We've got Jeannie. Um, Jeannie says she's interested in testing. Should I show my pediatrician your tests and ask them first because the pediatrician does specialize in autism? If we can get them through there. Do I make an appointment first with you to advise me on testing? Don't know what to test if I don't need to. Her daughter has the genetic testing done, but not sure what it shows. Well, Jeannie, I would say this, and then Nicole, let me ask you a question.
Yeah.
I would say yes. Show if your doctor says they specialize in autism, show them that the tests like the ones Nicole talked about, the organic acids and the stool tests and heavy metal tests, things like that, and see if they'll order it for sure. But Nicole, kind of taking that question to you, how do you see conventional pediatricians that you interact with? How do they react to this type of medical testing, which we put so much value in?
It's all over. I mean, it really, when we have a pediatrician on board, oftentimes because, patients need to have their primary care sometimes order the labs. So I'll give them a lab slip and say, hey, I find that most pediatricians are on board, especially if we're helping with the medical care.
Right.
Like, we're not just making a list and saying, here, you treat this. This is what you look for. And we're saying, no, just order these. We'll take care of it. And then they're happy to kind of delegate. So, some medical establishments, like over here in California, we have, Kaiser, which typically, doesn't want to do any of this stuff. But a lot of, private insurances, and medical practices are good. I think there's becoming a wave of understanding. I think people are becoming more open-minded. I've seen it in the last 8 years. Nice. It feels like people are more aware and oh yeah, let's check for, maybe vitamin D is important in autism spectrum. Like, sure, that sounds reasonable, Yeah. Let's get an RBC zinc or magnesium or whatnot. Yeah. So yeah, that's typically what we do. I think, like I said, it can be helpful. Sometimes it gets a little messy. Frankly, between you and me, I don't really like doing it because often the pediatrician orders the wrong thing. The kid's got a blood draw. It was traumatic. They come back. They got only a third of the labs. They're the wrong labs. And it's the parents went through all this mess. And, and I do what I can to accommodate them. But sometimes it doesn't work out, as well as us just doing it in the office. We usually draw blood in the office. We know what we're getting. And it's just the one stop. It's an easy process. So.
Well, good. That's good. Well, I'm glad. And again, it might just be California, but I'm glad, people are changing and adapting and saying, hey, look, maybe we can help. Maybe we can look at these things, which is great. But I'll tell you, and I'm sure it happens to you too, even when I order from the lab, I get the wrong stuff. I'm like, that's not what I ordered. This is electronic. How did this get messed up?
Yeah. Well, it really depends on the actual lab technician that's ordering, because they have to enter it in, So that's why it's best. I really like, we have a nurse practitioner. She's great. She does it and she knows exactly what she's doing. So.
Yeah. All right. Next question is from Brianna. Apraxia is their biggest hurdle. What helped your kids the most? And what did your time frame of speech improvement look like?
For me? Is that for me?
That's
okay. So for me, like I said, there was that giant study that talked about omega-3 with vitamin E. And I did notice that helped. Like I said, my son, we have cycled on and off of vitamin E. I do find that it's pretty helpful for him. For him, I noticed with his apraxia, well, there was a couple things. But CoQ10 helped him, and we use ubiquinol, like the active form. So CoQ10 seemed to help when I started that. Also, we ended up doing a big metal test, and I did a chelation challenge test, and we found that he had some lead. And so we ended up having to chelate him with some suppositories. He's probably gonna hate me when he's 20 for me saying this live. Mom. But we did end up chelating him and got the lead levels down to normal, and it did help his speech too. He was stuttering a lot and he was having a hard time getting the words out, and I found that his speech was more fluid when we did that. So those are kind of the few things that helped.
That sounds awesome, and I'm totally on board with apraxia, dyspraxia, and mitochondrial treatment.
Yeah,
we've got to get that going.
Yeah.
All right, let's see. Brianna, this question for you. Brianna says, if we are a patient of Dr. Rosignol's, can we see you as well?
Yes, absolutely. We're a team. So anybody can see anybody in the practice, and you just schedule an appointment with me.
All right. Sandra says, my son's on a very limited diet, only 3 foods. His gut is so bad. He's very low in vitamin C, and we tried 2 different kinds. It makes his stomach hurt, which it can because of the acid or reflux. How can I get vitamin C in him and not cause his stomach pain? He has epilepsy. Is marshmallow root safe? He also has low blood sugar, and I read that that can lower it further. What can I do? Well, let me answer real quick, and then Nicole, I'd love to get your 2 cents on it. What you want to look for is it's probably just the acid that's bothering you with the vitamin C. I would look for one that's buffered. So you can Google on Amazon or wherever you get your vitamins, buffered vitamin C. I would try that. As for the marshmallow root and the seizures and the blood sugar, I don't know. That's just not one thing I use a lot. But Nicole, any input?
I was just going to say the same thing. So like vitamin C is very acidic, and it can kind of kick up a lot of oxalates sometimes for kids. So I like the buffered, and I mean, I recommend well, I don't know if I should name specific products, but yeah, like a, pretty high dose, and they have a buffered with bicarb of magnesium, calcium, and potassium. So you get your electrolytes in there too. So I think it's a great combo.
Yeah.
I take it every night. I take it.
Nice.
And as far as the marshmallow root, yeah, I don't know. I don't use it a whole lot because there's not a lot of clinical trials. We try to base our practice on clinical trials because, we like to be evidence-based. We do go outside of the box too. I know marshmallow can be anti-inflammatory and can help decrease, bowel pain and sometimes transit, so help with constipation. As far as the seizures and blood sugar, though, yeah, I don't know.
That's all right.
Yeah.
No worries. There's so much out there.
Yeah.
All right. So Sonia's got a question. Hi, I'm having soluble folate receptors in the FRAT test.
Mhm.
Does that mean that the test is positive for blocking antibodies and dairy needs to be avoided? What's your opinion on those soluble folate receptor results in the FRAT?
Just for me.
Yes, I've got an answer too. Look, this is for you.
Yeah. So, I just was so the research, because these are pretty new, these folate receptor antibodies in the research, right? So it's pretty cutting edge. And initially, my kids actually came up positive for the folate receptor, soluble folate receptor, when we first tested them at like 4. And the initial thought was, oh, it's from cow's milk, and that this was from Iliad at the time. It's from dairy in your diet, and then it's in your bloodstream, and so you have to be dairy free. And it's mixing the results of the test. But I think that the research now is showing differently, and because at the time we were dairy free. So basically at this point we just consider it a positive test. And so in these kids, there was a recent study that just came out showing that these kids actually respond even more positively to high dose folate.
Yeah.
So it's really interesting with the folate receptor antibodies, because the higher the level, the higher the response rate is to leucovorin. So the soluble folate receptors are actually at the peak of that. So if you have those, you really need it, and you should actually. We've been pushing the doses of our treatments. We used to do kind of a max 25 milligrams twice a day, but we actually been bumping that up, and we're to even higher than that, and we're finding better clinical response, especially with these kids with these high antibodies. Like, oh my gosh, that's really high, so let's bump it up, and it helps.
Nice.
So
yeah. I was talking to the medical director of the FRAT test. I was talking to Sri last year about it.
Yeah.
And what he told me is that when the folate receptors are then soluble in the blood, it's because there's so much inflammation in the brain.
Yes.
That they're getting dislodged and circulating.
Exactly.
Yeah. So if yours are soluble on your FRAT test, more.
More. Yep. Do it. Treat it. Don't let that go.
All right. We've probably got 5 more minutes, so I'm going to look for some kind of targeted questions for you. Megan asks, how do you know, Nicole, that leucovorin worked for your kids?
So, with my one son, well, like I said, my daughter stopped having seizures, but I mean, it was, that was a big deal, big trigger. But my son too, I noticed that he was very kind of hyperactive and aggressive and irritable. And with him, he calmed way down when we started it. It was like night and day. Like, wow, he's really calm, which is opposite of what a lot of kids. I know that a lot of kids have the opposite story. It can cause hyperactivity, and I see that in my patients. So don't expect that necessarily to be true. But we had the opposite. He was hyper, and we gave him Folinic, and he calmed down. Awesome. So yeah, we even school had told us, what are you doing differently? Like, he's more focused, and he's able to like calm down and do his work. Nice. So was helpful. Yeah.
Yeah. I love that question from school. Your child's better.
Right.
What are you doing? That's
right.
That's when you know something's working.
Exactly.
Quick question from Tina. Does Dr. Rosignol's office require in-person visits?
Yes, we do require an initial has to be in person, and then the annual has to be in person, but everything else is a telemedicine follow-up. And then we do have 3 offices. So you can see, we have Southern California, Arizona, Phoenix, Arizona, and then Melbourne, Florida, right. which you can see at any of these places.
Yeah, and Melbourne's right outside of Orlando, I think?
Yeah, it's about an hour east of Orlando.
All right, sounds good. All right. Well, not a question, but I wanted to bring up Carolyn from Sweden says paracetamol, which is acetaminophen Tylenol.
Yeah.
Very common here in Sweden. They recommend it for infants. And yeah, look, this stuff is recommended by every pediatrician all over the world.
Yeah.
And it might be stopping acetaminophen and paracetamol might be the way to stop this epidemic.
Yeah.
If that's ever plausible. It's not the only cause of autism, but definitely.
It's not helpful.
All right, let me see if I can get a few more specific questions that I think will be really good. Not a question, but I want to read this. Diane says, my son regressed at 3. He had C. diff and another type of Clostridia bacteria. Mm-hmm. He was very aggressive.
Yes.
Because of those bacteria. And now that they've treated it, he's very sweet.
Yes.
So that's exactly what we're talking about.
I see it with my own son. My one son, we have to, it's been a chronic issue for him, and we struggled with it. We tried antibiotics. I've tried every antibiotic. We did Flagyl, vancomycin, Linea. At the end of the day, I just high dose probiotic him. Like we were on this revolving door, and then giving him anti-inflammatory, decreasing the inflammation can actually help too. Like, so he's on curcumin and omega-3s, healthy fats. But man, he tells me now that he's 12, he's like, Mom, I want kombucha. He loves the GT kombucha.
Nice.
And when he's not feeling good, he tells me, oh, I need some more kombucha, and he'll drink a whole thing,
right.
And then he seems to calm down. So yeah, treating the Clostridia helps. And ideally the goal is to get your kid to tell you when he needs it.
Yeah, no, that'd be awesome. Yeah. Now, let me ask a specific question. When you say high dose probiotic, what is it?
Good question. So we initially were doing VSL3. This was back in the day. So we were doing like the 900 billion. And yeah, I mean, for a little kid, and I was mixing it up in some like coconut yogurt for him. And that helped. And then, there's other ones that we've now kind of, like I said, titrated down, but we did that for a while. And there's another product. I mean, I like some of those live gut shots, like the BioK that you can get at Whole Foods or Sprouts. Those are really effective. I found even more than, a lot of the pills. So those can, you can do those. I mean, we were doing them 2 or 3 times a day, just until his stool was firming up and stopped smelling, and a lot of times, because like I said, for years, we were doing these antibiotic cycles, and I was over it. We tried Biocide, and we tried some of the natural stuff. Right. And it just wasn't moving the needle like when we were just high dose. I mean, I was really toying with the idea of a fecal microbial transplant.
Yeah.
This close. Yeah. I wanted to do it, but I got scared, because I don't know, I just don't know we're going to get a good donor, and is it going to be a fit? And I don't want to cause harm. I mean, I'm the medical practitioner that's like, do no harm first.
Yep.
So I kind of shied away from it, but I thought, well, what's the theory? The theory is we need good bacteria. Okay, well, and obviously the diversity is much better in FMT, but I did find that the probiotics helped.
Well, that's awesome. And so for people who are listening, understand, like a really good probiotic probably has 30 billion per capsule. Mm-hmm. Okay. Get something over the counter like Culturelle, it might have 1 billion. Yeah. You said the number 900 billion. So I want to make sure people are understanding the difference in dosing.
Yeah. And well, it was prescription prescription only. I mean, the idea is, and I've heard other practitioners say, well, you got to be careful because theoretically you can get SIBO from that much. You can get lactobacillus SIBO.
Yeah.
And so you don't want to do that long term. Like,
No.
it's not something you're going to do for like the rest of his life. But instead of doing another antibiotic, we did it for like 30 days or I think 60 days to get him back on track. So it's not something you want to do continuously.
All right. Awesome. All right. We got time for 2 more questions.
Okay.
Let's see. Just want to find some good specific questions here. I like this one. Diane asks, how do you decide if your child needs B12 shots? Or can you just do B12 orally?
Yeah, that's a good question. So there's a few tests. If you look at the organic acid test, there's actually like a B12 section, and that shows how deficient they are. You can look for B12 in the blood, which is not very effective at all. Because like Rossignol was saying at TACA a couple months ago, that they've now found B12 receptor antibodies. So the idea, and this is brand new. So the idea is that these kids may have enough serum B12, but their antibodies are preventing it from getting in the brain.
Right.
So essentially, there's not a test for that, like there is for folate receptor antibodies right now. There probably will be in a few years, and we'll be talking about that again. But for right now, in our practice, a lot of times we just try it. We just order them and they're really well tolerated. They're really low side effect profile. Hyperactivity is probably the biggest thing we see.
Yeah.
And so it's like, yeah, you want to try it? Let's try it. And then you see how your kid does.
That's exactly right. There's so much trial and error with this stuff.
Yeah.
But the good news is that there are things to try. And if that doesn't work, there's something else to try and something else to try. One of my pet peeves is when I talk to families and they're like, oh yeah, I've done this thing for 2 years and it hasn't worked yet. Do you know when it's going to work? I'm like, oh my God, it's time to stop that and try something else.
Right.
So,
right.
time ticking.
Oh, and to answer the question too, she had mentioned oral B12 specifically, so I didn't address that. So initially, depends on the GI inflammation. So when these kids are young and their guts are really inflamed, they're not going to absorb it orally. Even the sublingual, I find, doesn't work very well. So I would do the injections depending on how you think their gut situation is. My son used to do B12 injections. He actually came up like he needed it. He was deficient on an organic acid test. He was that bad. So we were doing injections when he was young. But now that we've kind of figured out his GI a little better, we do the sublingual daily. Because I got tired of giving him shots for a decade. But I would, if I had to, I would. But I once you decrease the inflammation and they're having good transit, they're having normal zinc levels, once that normalizes, they'll absorb it better orally, sublingually.
Great. All right. Yeah. Last question. And this is from Haifa. Haifa says, I have twins who are both diagnosed with autism. Your story, Nicole, gives me hope.
Oh.
How old were your triplets when you started treatment? And let me add on to that question for you, because I think it'll be a better answer. How old were they when you started treatment? And then what's kind of like the general timeline you saw of their improvement? Because now you've lost diagnoses.
Yeah.
So give our listeners your general timeline of your kids and what happened.
Yeah. So, 2 years old, when they turned 2, that was like the worst. That was like the trough, of where we were. And then, like I said, I didn't do much for about 6 months. I started maybe 2.5 or so. By about 3, ironically, we saw improvement even by like 3, maybe 6 months into treatment. I was like, this is working. Nice. Now, by 4, we were starting to get some speech back. And, by 5, 6, they were behind still, maybe like a year in school. There were behaviors, there was things. I really started to feel pretty good by like when they were about 8 or 9, maybe 3 or 4 years ago. They were really starting to seem more neurotypical. And when I could take them to the grocery store, people wouldn't look at us like, what's wrong with your child? And why is he screaming and spitting and, all this kind of stuff. So, and don't get me wrong, we still have stimming and we still have some OCD, we got all the fun stuff, but now they're just kind of quirks. And, I think they have more cognition to control them when they, when they need to it. But yeah, so that was kind of the timeline. And now, I feel like at 12, I feel like, puberty's really helped my sons. They're kind of in that stage,
Yeah.
but that seems to have really helped their cognition. I don't know if that's common for everybody. I do hear that with some of my patients, that for the boys, puberty helps. Some kids regress during puberty,
Yeah.
but I'm kind of actually kind of finding the opposite. Thank God that, you know, it seems to be helping.
Yeah, for sure. Well, I mean, even just with, progesterone and seizure activity,
Yeah.
that huge help with puberty.
Right.
So
Right.
that's awesome. And I kind of want to reframe your answer.
Okay.
For people to hear that this took years.
Yes.
This is not overnight.
Yes.
But you see improvements on the way that motivate you to keep doing it.
Yes.
So I think, and I talk to my families about this because everybody asks, is this going to work? When's it going to work? What should I expect? What's my future? Because everybody wants to know.
Right.
It takes a long time, but it is doable.
Yes.
Yeah.
It is doable, and you got to try. What's really helpful for me is like it's a marathon, not a sprint, and you really got to get your team together. I mean, my spouse, my husband, he's been really supportive. He's just like, yeah, whatever you're the expert, whatever you want to do. I mean, we'll spend the money, okay, and giving my mom on the holidays to cook gluten-free for us and getting her on board. Hey, watch this video, mom, like gluten-free is important. Hey, finding a doctor, like a team that you can call when your son or daughter's not doing well, just getting a support system that's going to help you along the journey. And if people are really pushing against you, then you just got to kind of let it go and be like, well, this is my journey, because there's going to be a lot of naysayers. There's going to be a lot of negativity, and you got to follow the positivity, follow your hope, follow the light, because it matters. Your team matters. Your tribe matters.
Yeah.
So
I could not say it better. So, all right. Well, thank you for coming on. An hour flies by.
Yes, I know.
It's always,
right?
But I've got a couple housekeeping announcements to make. While I'm making those, I want you to think, what last comments do you want to make sure our listeners know? So you think about that for 20 seconds. Couple of our housekeeping things. Next week is Thanksgiving. We will not be having a live podcast next week. Happy Thanksgiving to those of you in the US. We are having our big Black Friday sale, which starts Wednesday and then goes through the weekend. We've now have our new Black Friday checklist. So if you go on our website, you'll see the Black Friday checklist, and you can download that, and just so you know everything that we've got on our website. Coupon for this weekend is going to be Lab 20. Lab 20 is going to get you 20% off any of the supplements on our website. And yeah, Nicole, any last important nuggets for our listeners? And make sure you give them your website again.
Yes. Okay. I just kind of piggybacking off and what we were talking about, there's always hope, and to not give up. But the thing is, I remember when I was young, like when I was starting out with my kids, like it feels so overwhelming. And so it's so much like, oh my gosh, what do we do like this? I want to start. Where do I start? And so, picking something small, can really just narrow it down to one. If you do anything, do one thing. You don't have to do 10 things in a week to try one. Let's just try removing the gluten, or let's just try this one. Just try one thing, try to keep it small. If you're having a hard time starting even that and don't know where to start, then yeah, you're a good place to start. I'm a good place to start. Find a professional, but don't let the enormity of it overwhelm you. Just start small, and it doesn't have to be an all or nothing. You don't have to do all the treatments or none of the treatments. So yeah, just do what you can. Awesome. Do what you can. So it's always enough, right?
Yeah. I mean, and any little thing is better than no thing.
Yeah.
So it's better than yesterday.
Yep.
I love it. All right.
Oh, and my website. Yeah, you wanted me to say that. Sorry, my website again is www.nicole, Nicole, Rincon, Rincon.com.
Awesome. And you are located in Orange County, which is a little south of LA, for anybody who wants to come see you face to face. But thank you for coming on. It was great conversation. I always love it.
Thanks for having me. I appreciate it.
Yeah, anytime. And everybody out there listening, thank you for doing everything you can to help your child. And we will see you in a couple weeks.